So a registered nurse is providing care to a client who has sustained burns on both arms and the right leg. According to the rule of nines, what is the total percentage of body surface area affected by burns? So I really like to tackle these questions by looking at each body part and then adding it up, okay? So we know that one whole arm is how much according to the rule of nines? You got it, 9%. So with this question, we have both arms were burned. So we know 9 plus 9 is 18. Now, even if you don't know this off the top of your head, you can think, the right leg, okay, a leg is bigger than an arm. So how much do you think one leg is going to be worth when we're calculating? You've got it, 18%. So we know that one arm is 9, the other arm is 9. That's 18% for both arms. Plus another 18% for that right leg is going to be how much? You've got it. It's going to be 36%. So if you chose number 2, you'd be absolutely correct. Great job.
Our question says, the nurse in the emergency department is caring for a client who has slurred speech and left-sided facial droop and weakness. Which of the following actions would be a priority for the nurse to take? So this word priority, that means that we may want to do all of these things, but we should do one of these first. One of them is more important. So let's look at our options. Option 1 says to administer IV dextrose to the client. This is an incorrect option. With this client who is experiencing slurred speech and left-sided facial droop weakness, we are suspecting they're experiencing a stroke. But we cannot give IV dextrose without checking a blood sugar. Hypoglycemia may mimic signs of a stroke, but we would want to check the blood sugar first. We can't just go administer IV dextrose, right? So that's not our correct option. Option 2 says to prepare the client for a 12-lead ECG. This is something we would want to do, but not as a priority, so it's not our correct option. An ECG can be helpful in maybe figuring out like why the stroke occurred, like if we have AFib or something like that going on, but it's not going to help in the like immediate acute care of a stroke. Option 3 says to obtain a blood specimen to check the client's serum potassium level. Potassium levels aren't really associated with stroke. They can cause some cardiac issues, so we may want to look into that with that ECG if we see something abnormal. But it's not something that we're going to do to like acutely figure out why this client's experiencing these symptoms. And then option 4 says to transport the client to radiology for a CT scan of the head, and this is going to be our correct option. So with a stroke, time is brain is time. We want it to be quick. We need to go for a stat CT. That CT scan is going to rule out a hemorrhagic stroke or determine the presence of hemorrhagic stroke, right? And that's going to determine our treatment and ultimately determine our outcome. So anytime you think stroke, a CT scan should be the first thing we're going for. And that's just really important to remember. And you can see a stroke in all settings and clients, that you don't really expect it. It's not just in the emergency department. So you always want to make sure that you're kind of aware of your stroke protocol. And a CT scan will definitely be part of that. So I will see you guys tomorrow for another neuro question.